This in-service video will provide basic instructions on the use of the SubQ It Bioabsorbable Skin Closure System from Opus KSD. Always refer to the instructions for use packaged with the product for complete information. The SubQ It stapler is preloaded with 10 fasteners, sufficient for an incision 10 centimeters long or 5 shorter trocar incisions. It is shipped sterile for single patient use. Do not expose to heat, as this will damage the bioabsorbable sutures, causing the stapler to jam. Steps to use. Open the foil pouch and remove the stapler using sterile technique. Remove and properly dispose of the plunger lock. The plunger will not operate unless the lock is removed. The SubQ It stapler is operated by an assistant, while the surgeon positions the tissue. The stapler is held like a syringe, so the thumb is able to push the plunger fully until it stops. The assistant's other hand is used to advance the body of the stapler into position. Using 2 Adson forceps, grasp 2 to 3 millimeters of tissue on each side of the incision at the point to be fastened. Then bring the forceps together and lift the tissue. Slide the stapler feet into position so that the forceps locators are directly below the tips of the forceps. Hold the forceps at a 45-degree angle and press the tips into the forceps locator pockets. If either of the forceps does not feel locked in place, raise the back of the forceps higher and recheck by pressing down. Deploy the fastener by pressing the plunger using a smooth and deliberate motion until the plunger stops. The sharp needles deliver the SubQ It fastener into the dermis, and then they retract when the assistant releases the plunger. Release the Adson forceps and remove the stapler. As the tissue returns to its normal position, the barbs on each leg catch in the tissue and hold the incision closed. Small dimples on either side of the incision and mild eversion indicate that the suture is secure. For longer incisions, begin 1 centimeter from the apex farthest away from the surgeon and advance the stapler toward the surgeon, spacing the fasteners approximately 7 to 10 millimeters apart. Release, raise, and reapply the stapler each time to obtain an equal distribution of the tissue for each leg of the fastener. Each time, the surgeon should lift the tissue to a height which provides the amount of tension that would be needed to pierce with a suture needle. The assistant then deploys the stapler at this height to ensure that the tissue is sufficiently taut to be pierced by the SubQ It needles. When completed, confirm that the incision is secure by spreading the tissue with your fingers, as shown. If additional fasteners are needed, they can be placed between previous ones along the incision. Subcuticular or intradermal stitches are not needed to close the edges. The set-back dermal position of the SubQ It fastener keeps tension off the skin edges, which results in minimal scarring. Gauze and a waterproof covering are recommended as a dressing, but other post-surgical dressings can be used according to the surgeon's preference.
To hold the tissue against the strong insertion forces, 2 mouse tooth Adson forceps may be used, but for greater security, we recommend Adson Brown forceps. The dual serrated tips are stronger and also provide a good indicator as to how much tissue is grasped. Tissue can be very different, sometimes thin and stretchy, other times dense and tight. The best results are obtained by adjusting the amount of tissue grasped to compensate for these differences. If the tissue slides very easily into the feet, the surgeon should release and grasp more. Note that by reaching deeper and completely covering the 6 millimeters of the serrated tips, the tissue now completely fills the space between the feet. This video shows the opposite situation. The tissue is dense and firm, so compressing it between the feet is not good. Taking less of a bite into the forceps or undermining subcutaneous tissue will allow the tissue to be smoothly placed between the feet. The goal is to grasp the amount of tissue that smoothly and firmly slides into position.
Manually inserted subcutaneous sutures may be used to close dead space. However, if manual sutures are used, place them at least 1 centimeter below the dermis, leaving sufficient tissue to be positioned in the SubQ It stapler. The assistant should hold the stapler feet in constant contact with the forceps. Do not lower the stapler first and then the forceps, as this folds excess tissue into the path of the needles, and the fastener will not be inserted correctly. The assistant can fire the stapler while holding it above the skin surface, placing a finger under the back edge of the stapler for support. As an alternative to holding the stapler up, leaning the stapler back will also tighten the tissue so that it can be properly pierced. If bone or other interferences are less than 5 millimeters below the skin surface, this same technique of leaning the stapler back will keep the needles above the surface and will avoid the interference. Do not press the plunger partially and then release pressure. This will cause the fastener to fall from the needles and may jam the mechanism. When all 10 fasteners have been deployed, a black stop mechanism will appear and will block the plunger. Do not attempt to force the plunger down. For more information about SubQ It, please refer to the instructions for use or visit our website at www.subqit.com.